Hello. Hi. Hello, everyone. Welcome. Welcome again. Today, we have a Facebook Live event, which is a feedback session after our SUDEP Masterclass training that we had in August earlier this year. My name is Tololanian, and I'm the CEO of Pretola Global Health and Consulting. Welcome to our Facebook Live event. With me today, I've got 3 people that attended the SUDEP Masterclass event that we had earlier this year. And today we're just here to have a bit of a conversation about sudden unexpected deaths in epilepsy, the masterclass in itself, and what it also means to us in our countries. And I'll ask our first panel member, Adam Jalajane, to introduce herself and tell us a little bit about yourself, what you do.
Hello, good afternoon. My name is Adam Jalajane. I am the president and co-founder of FESCAM, Foundation for Epilepsy and Stigma Support, registered in the Gambia. And our vision is to improve the lives and livelihoods of people living with epilepsy. And we do a range of activities from capacity building, education, outreach activities. So today I'm just excited to share a platform with beautiful Nina, our handsome brother Thomas, and of course CEO Tulu. So thank you for inviting me.
You're welcome, Adam. You're welcome. And Thomas?
Hello, my name is Thomas Zekawi from Nigeria. I work at Pretola Community Health Service where I serve as easy technician, also an advocate. I'm very happy to be here today, and I've been part of the first masterclass, which I enjoy a lot. So, be about today, I should be able to do what to you, and to help to move on forward.
So unfortunately, Thomas, we couldn't hear you properly. So do look at the microphone of your device, see if you can increase the volume a little bit, or maybe you need to move it closer to yourself so that we can hear you. But Thomas is Thomas Kawe is an EEG technician from Liberia. So he's actually connected from Liberia at the moment. So hopefully we can get it all ready. But thank you for joining us today. Nina.
Hello, everyone. Thank you for having me, Tolu. My name is Nina Mago. I'm the founder of the Purple Bench Initiative, as well as the executive director. The organization is a grassroots organization supporting people living with epilepsy and their carers. One of the other things that I do is that I'm the lead advocate of the organization. And I'm also a youth team member of the global youth team of the International Bureau for Epilepsy.
Thank you for joining us today. And just to put a little bit of context to it, this year we did a masterclass. So I'm from Pretola Global Health and Consulting. Like I mentioned, we ran our first masterclass on sudden unexpected death in epilepsy for people in low or resource countries. So the training was attended by both people with epilepsy, families, carers, and clinicians from over 50 countries. So we had nearly 315 participants from over 50 countries. This is the first time we'll be doing this training, and it was so important that we had this training. Hence why it's also important that we have this feedback conversation about it as to why did we even need to do the training on sudden unexpected death in epilepsy, and also why did you attend? What was the impact? And we would want to know just a little bit more. And also, should we do it again? And I'm sure we all have our answers to that. So I'm going to go for our first question. And the first question will be to Nina. You attended the training. You are a person with epilepsy yourself, and you also obviously have Purple Bench Initiative, and you attended the training. How was it for you?
It was a breakthrough training. I've attended many of Pretola's trainings, but this was a breakthrough because it's, what can I say? I think I can make mention of it being really close to my heart in terms of risk management and knowing what to do as a result of having that information. I mean, how can we say we are talking risk management if we don't know what the risk is?
You're right. How can we manage risks if we don't know what the risks are? How? Very difficult. Adam, what was your experience on the training?
For me, I would say it was very emotional because when I posted it on my status, the few that I've got contact with, like our patients at the clinic, all I was getting was like, oh my God, I'm really gonna register for this. And the next minute is like a picture of I've registered, and they send me a screenshot that they have registered. And then it was like, and then I started to think about myself, obviously, because I do have a brother who lives with epilepsy. I support my mom to actually support my brother. So I was thinking, I've never had this conversation with my mom. And if I was to do it, where do I start? I didn't have the tools. I didn't know what to say. I'm like, okay, this is a must attend. So it was for me, I went in thinking, not only of myself, but the fact that conversations like this don't really happen in our countries. Yes, you will be told you have epilepsy, but what you need to do, how to manage it, especially when it comes to SUDEP, we know that, it happens. The fact that it's not recorded doesn't mean that it doesn't. And our culture as well, how would you have a conversation about death? It's not something, the African culture, we wouldn't welcome that. Even when you say anything about this, everybody's like, no, you can't say things
God
like
forbid.
that. Yeah, exactly. So for me, I was like, and this was for lower middle income countries. So I was excited. At the same time, I was like, I wonder what kind of questions will be asked and how do people feel about it? So I felt like it was really relevant. And of course, we should have it again and again.
And again, and again. Thank you. Thomas, you coming from a clinical background, and obviously as well, you are an epilepsy advocate in Liberia. What was your take on it, and what was your experience like on the training?
I felt very happy, and like somebody being affected. I lost my sister to SUDEP before in 2010.
Wow,
yeah.
I didn't know that.
Yeah, 2010. And we got out that morning, my mother gave me a call. And she told me I lost my sister. At the time we been managing her, helping her. So when I heard about the SUDEP, and like in my country, it's hard. It was the first time if I to hear about this class, to hear about this training. So I was like encouraged. And I couldn't wait to be part of it and to even maybe go around. Work at the time I've been in the rural area. I have to come back to town, get this idea and go back there. Maybe travel up to maybe 8 hours drive to get there. So it was great. It was great. It was great.
So sorry about your sister, Thomas, and I was not aware of that. And I'm glad you're able to attend the training. Happy to speak to you afterwards if you want to have a chat. But thank you for sharing that with us. And just listening to us speak actually reinforces that SUDEP is real. And I had tried to link up with a clinician about, in a low resource country, about when we're putting together this training about SUDEP, sudden unexpected death in epilepsy. And this person said, there's no SUDEP in my country. And I was like, is that right? Or actually, I think the problem may be the fact that it's not recognized and it's not recorded. If there was something that was quite profound, and I remember Adam, putting a chat about this during the training, was when Professor Rohit Shankar was talking about the SUDEP register, the mortality register, and everyone on the training was putting in the chat that we don't have that in my country, we don't have that in my country. Hence why it's so easy for sudden unexpected death to be unrecognized and not even acknowledged in low resource countries. Loads of factors, including not being able to carry out, what's it called now, post-mortem, due to practical reasons, and also cultural and religious reasons as well, because there's some religion that you can't really defile the dead. And they bury their dead within 24 hours. So how are you
Yeah.
going to, how are you going to carry out post-mortem? And in some countries, they don't even have the facilities to do that. So it is real. Just hearing Thomas share his experience now, it is real. It's happening. But unfortunately, it's unrecognized. Adam, do you want to say anything about that?
Well, just to confirm, because I remember actually typing on the chat when we had the training that it's not recorded in the Gambia, because for me, I was just like, I came after SUDEP and after IEC conference, I came across some data which is shared by WHO and the Ministry of Health of Gambia. So there is a section that actually talks about major NCDs. Obviously, epilepsy is not included in that. And then there's a bit, epilepsy is discussed on the, or is actually, yeah, it's discussed on the mental health. So that's another, that's something that we are trying to work on to make sure that it is discussed under the right heading. And to my surprise, there is a column for major NCDs, which includes like diabetes, hypertension, asthma, and you have death figures on there. But with epilepsy, there was nothing recorded. It was not even like, it's got a heading with a 0. No, it does not exist. Wow. So that just confirms that, yes, the data is not available. But I can tell you through our work, the foundation, FESCAM, we have come across family members who have shared stories of losing members of their family. True. So it does exist.
It does exist. And Nina, I'm going to come to you here. When we're talking, you shared your experience that actually you'd never had a conversation about SUDEP before, right, Nina?
Yes.
So you've lived with epilepsy for most of your life, and you've never had a conversation about sudden unexpected death in epilepsy and the potential risks and how to manage it before.
No, I've never had that conversation, but I also kind of feel like every day is a risk for me, regardless of whether we're talking about SUDEP or not. Because I'm also asthmatic, and Adam has just talked about, the other NCD, that considering all these other things, you go by in life without really looking much into this. But it's important that you get this information and you understand what it is that you're dealing with. And I mean, for starters, when I got to know during the training that having another condition like asthma makes the risk of SUDEP even worse, it made me think, gosh, why is this information not being given to us? I am always getting asthma attacks. It has been good, along the way, but it's been something that I've been having to deal with. But to think that these things are being looked at independently,
but not together,
is an issue. Even pregnancy is one of the other things that I found out that, but how many people want to have kids? How many people is that conversation had? So it's important that we keep getting people trained and talking about this. It's important that we get this information.
Usually, I think usually the conversation is more like, if you're a woman, you have epilepsy, 99% they will tell you, you can't have kids. You just can't have kids. That would be the conversation, rather than how can we help you if you really want to have a child.
Exactly.
It's so true. In fact, let me just add something to what Adam has just said. You will not be told anything else other than you need to be careful. We can't afford to have mistakes. And these mistakes means like the unplanned pregnancy, but they're not telling you why. Like, can you tell me why this and this and this is the issue, so that, we need to know the risks.
Yeah, and how can it be managed? I'll come to Thomas here, being a clinician, and I know you're not a neurologist, but you work with people with epilepsy as an EEG technician. But let's think about this in the concept of our countries, our cultural, where we're at. what are the barriers? Why do we think people are not having these conversations about, like clinicians are not having these conversations with people with epilepsy and their families? Is it a knowledge thing? Is it that they're not aware of it? Or actually they're scared, or they don't know what are their cultural issues that actually prevent those conversations from happening? Thomas?
Yeah, one of those things is lack of education. And in my setting, I think Adam just said it, epilepsy is being treated as a mental health disease in Liberia. So like you go to the mental health center and are you getting me?
Yes.
Yeah.
Yes.
I think my skin is having some problem. So if you go, everybody have to go to the mental home of the medical center to receive refill medication. That's a common referral hospital in Liberia. So like people, many of the patients we see, you know, you go and say they're mentally ill. Like more women and children, they are denied of going to school, they be denied of marriage. And, you know, like I got many other stories, you know, like a girl, she had a relationship when she had her first attack. They told the man to walk out of her. You know, she began to cry, like this, the stigma, no proper education. These are things that actually is affecting our society, our patients, our clients. So we, at this part of the earth, we are trying our best to see how best to train students at various schools, even the churches. We go to churches, you know, on a Sunday, talk to people, have a workshop, go to various schools. And people in Liberia who are not still educated to even like telling people it's not contagious. Many of the people on the street, when somebody have an attack, everybody run away. Now in the church, somebody drive or get dropped, 15 years old get dropped in the church, and the service will like scatter. So I was alone. You go and talk to the pastor, say this is not real. It is false belief. It's a treatable disease. So like we just need to educate people, have a lot of this training, you know, encourage people. Even some nurses, you tell some nurses about epilepsy training, that they say, oh, I don't want to do this, I don't want to do that, you know. So it's like the barrier is many here in Liberia, is many here.
You're right. Starting with epilepsy awareness first, you know, just thinking about what you said, that someone had a seizure in church and everyone just ran out of church. That is so significant. That is so, they're not going to want to go back to that place again. You know, and they're going to miss out on the community, on the fellowship and meeting with other people because of the way they've been treated, you know, in that venue. So it's really important that we create awareness. If people are not aware of epilepsy, do not have the right information about epilepsy, we can't even go into having the conversation about sudden unexpected death in epilepsy, isn't it, Adam?
Yes, I just couldn't wait to add to this, because I'm just saying, for example, in Gambia, you know, our treatment gap is actually 90% if I code the CMD of Edward Francis Small Teaching Hospital. So that means out of 10 of every person living with epilepsy, only one person is receiving treatment. What we know, SUDEP, the major causes of SUDEP is lack of treatment. So now work out the figures. Just because people don't come out, and first of all, people don't talk about epilepsy. They don't go to hospitals, they're in the homes. And if these people lose their life, it's not like it's going to be people didn't even know they had epilepsy to start with. So how are these figures going to be recorded? So I always advocate the fact that with epilepsy, everyone needs, all the stakeholders needs to stick together. It's cannot work with one, you know, the neurologist working here, the nurse working there. It has to be a multidisciplinary team where we have, you know, parents of people with epilepsy, if it's a child, the person living with the condition, you know, we need a holistic view of how do we look after people with epilepsy. Without that, we're not going to win anyway. We're talking about SUDEP, and now we're talking about stigma, awareness. So we cannot discuss one and leave the other.
Yes.
So that's what I wanted to add, that if people don't talk about epilepsy because of stigma, why would epilepsy death be reported? It's not going to happen.
Yeah. Nina, do you think people with epilepsy and their families want to know? Do you think it's important they know about this?
I mean, I can speak for myself.
Yeah. Do you want to know? Do you think your mom and your
Yes. While it can be a daunting discussion to have, it's important that people know. Like Adam said, it should be a multidisciplinary unit that is discussing this. You were asking about some of the other things that are creating or posing a challenge for SUDEP to be discussed. We talked about culture, but we also need to realize that our cultures are so diverse. When you haven't even added religion to it, given that I'm coming from a religious background, same as Adam, 24 hours, there would be no opportunity for anything to be checked about what happened to me. You know, that would be it. But the cultures are also quite diverse, and our cultures do not talk about death. One, death itself, the person who has died, in that you can ask what happened to this individual, and all you'll be told is he or she had her or his problems. And that would be the statement for someone who has died from unexpected death from epilepsy. He had his problems. And when you also realize that some of these things, because they are not discussed, do not come to the forefront, something as simplistic as, oh, this person has epilepsy, but is also having a cold. For some reason, in communities, people think that the person who has epilepsy does not suffer from anything else. Like they were put on earth to manage themselves. So they're not to be taken to the hospital if they have, you know, anything else that's visibly ailing them, because they have epilepsy. It kind of figures itself out. So there are a lot of things that are leading to this that we need to discuss.
It's multifaceted, too many angles to it. And that's why it's really important to start talking about it. And I put a post up on social media a day before, I think the training was, or actually the day that, look, I've put together so many trainings. I've put together different training. I've talked, I've talked internationally and a lot, but this one was different for me because the responses, the comments I saw about it made it so it was more or less like this was the ultimate training I'd ever put together because of how important it was and it is to talking about epilepsy globally, you know. SUDEP talking about sudden unexpected death globally, much more so in low resource countries. And Dr. Eddie Chengo, one of our speakers, said something, if you all remember, he said, death is a taboo in Africa. And he's from Kenya. He's from East Africa. I am from Nigeria, West Africa, and I could resonate with that. And just knowing that we are broaching topics here that may seem quite huge, but so important because people with epilepsy need to know and their families need to know so that they can actually manage things better. So I'm so glad we had the training. We had 3 speakers, Dr. Eddie Chengo, Professor Ray Shankar, and Kim Morley, Kim's session about women, pregnancy. Oh, that was mind-blowing in itself. So now, before we wrap up, how would you apply that train? How would you apply the knowledge gained? Nina, how would you apply it to what you do and of course to yourself as well?
Well, it, I think, would make me a little more forceful when I have to go and see the doctor. I've always been forceful, but this time around it will be like, you know what? Let's not think about what because some of the doctors fear that the mental health aspect of it. How can I start telling this person that they could die from something as if they're already not, you know, carrying a weight already? Sometimes it's important that that discussion is had. So I am bound to be more forceful about having that discussion with my doctor than I have been. Because every time that discussion hasn't been had, then I've gone out and gotten that information myself. But it's like you're in a relationship with your doctor. This is a relationship that we have. You're being unable to give me that information. You're holding back. But when it comes to the organization and the young people that I keep talking to, it's a discussion that I'm going to be very open to have. This might not mean that, we're going to die. We are going to die in a sense, but let's manage the risk. I don't know if it's more important, and I think Thomas can tell us, if it would be a discussion better had with clinical psychologist or someone. I do feel like there are people who might not be in position to take it as I have taken it.
Yeah.
So I think there is need to have a therapist, clinical psychologist, when that topic has to come up, or if someone has asked about.
Thomas, from your perspective as an EEG technician, patient advocate, and of course working with people with epilepsy in your clinic, what is your take home from that training, and how would you apply it to your practice?
Yeah, first of all, I want to say more thanks to you, because you have always been there to give us this knowledge. Like through the session we have, the MCG session we have every year, have contributed to a lot of knowledge that I'm applying today. So I also want to say thank you. And one of the things I did learn from Dr. Shaka, that he talked about risks, what are these risk management, and all back down to education. We need to educate this family, because like many of them still don't know, what exists, what is happening, they don't know. So at the clinical level, the first thing we do is that we have a social worker, and he do the family counseling to these people and educate them about their patients. Like Dr. Shaka said, patients need to be monitored at night. If you don't educate the patients, their relatives, how would they help? How would they apply this thing at home? Because we are clinicians or advocates will not be at the rural homes all the time. So the family needs to be well counseled, as she said, as Mina said they will need a therapist at home that will educate patients, that our effort will not go in vain. So at least we want to get rid of this stigma, and so we can have more patients safe.
Yeah. And what you said then about night monitoring is so important, and very much emphasized on that training about nocturnal seizures, night monitoring. We do know that it's not everyone that is aware of that, and it's very important that we mention that and we reinforce that for families to know.
I had a case studies. I had a case when I had a bone fracture. I was in Bon County, part of Liberia, and I was there for like 2 weeks. And this woman brought her son. She said her son saw, there was still a party pump. He saw something passing.
Oh, he's frozen.
Oh, we've lost Thomas. Adam, let's come to you. We'll probably come back to Thomas later. Adam,
sure.
What's your take-home message from the training?
For me, it's like, thank you to your organization and also your sponsors, because going into the masterclass, I wasn't sure, because my brother has he doesn't have seizures during the day, but I believe he has them at night, which that's when, most people who's lost their life to SUDEP is usually when they're sleeping at night. And then for me, it's not something that I've discussed with my mom. I don't even know where to start. So after the training, if you ask before, I wouldn't be able to answer whether people should know, people with epilepsy should be told about SUDEP or not. But after the training, I believe if you ask me now, I'll say yes, the information should be available. People with epilepsy must know about SUDEP and the risk actually associated with it. Now, the how and the when, That's where I would say more work needs to be done on that, maybe research, just to see what works within our context of Africa, lower middle income countries. And it should be looked at an individual level rather than a general guideline for everyone. That would be my comment.
Yeah, you're right. And you know, when Dr. Eddie Chengo, when he took the first session, he mentioned about how he would go about it, that he would discuss risks. He would, you know, as he's working with the person, you personalize it. It's so important as clinician. You don't just come and then bang on. Oh, you're gonna no. You have to personalize the message. You have to work with them. You understand where the person is at, if they've even accepted, you know, their diagnosis of epilepsy. Do they even know what they've got? And then start to work with them. But obviously at some point, you know, discuss SUDEP in depth, but you're already managing the risk so that they understand nocturnal seizures, compliance with medication, and if possible, in some countries they have access to monitoring device, you know, and a whole lot of other things as well, which is available, and it's important we discuss, but we know we don't really have that in our countries. Like, but those are things we need to push for. The more we talk about it, the more, who knows, someone may decide, oh, we're going to create one for low resource country, we're going to cheer you on. But really, that training was so powerful. I'll probably say it's one of our best training because of the fact that it was obvious that there was a gap here, and there is a gap, and there's still a lot to do about it. But I want to say thank you to you guys for joining the training, because imagine if we put the training together and everyone did not register. So thank you for joining and sharing your take on it and your feedback to us. And also, I really do want to say thank you to Danny Deed Foundation in the US, and also Rowe Foundation. Danny Deed Foundation, they do a whole lot of awareness. They do a whole lot of, you know, training and awareness talk and programs around sudden unexpected death in epilepsy in the US and in other countries as well. And they decided to join us this time on low resource countries. I was so excited, you know, to work with them about it, to work with them on it, and they were so, you know, helpful as well. And also Rowe Foundation helped us, sponsored us. So both organizations, having them on board, helped us to put that training out. No one paid a penny for it. It was free, helped us to put it together. And now hearing the feedback made it, you know, it was definitely worth it. So I do want to say thank you to both organizations as well. So we're going to wrap up now, and we've come to the end of today's discussion. Thank you, Adam. Thank you, Nina, and also thank you, Thomas. I think he's having some technical issues, but thank you all for sharing your feedback with us live on this discussions. More training to come. We're not going to stop talking about SUDEP. Actually, this is just the beginning, because there's still a lot to discuss, and we're hoping to have a SUDEP focused EAMC next year, our next 3 months training. We're hoping to have a whole day on SUDEP again as well. So thank you all, and do have a lovely afternoon. For those joining us on Facebook, those who would watch this afterwards as well, thank you. And if you've attended the training, put your comments on Facebook. I'm sure we'll all love to hear from you. But do have a lovely afternoon. Right.